Hello and welcome, Dr. Sumlin, to the People of Color Living with Diabetes Virtual Summit. Please tell the viewers a little bit about yourself and the work that you do.
Okay, so I am a clinical nurse specialist, which is similar to a nurse practitioner, except I specialize. And so I have been working with people with diabetes now for the past 14, 15 years. I always also was a diabetes educator before that. So I've been doing this for a very long time. And I'm also a professor at the university here. I've been teaching both graduate and undergraduate nursing students for the past 6 or 7 years. I am also an entrepreneur. I do have my own company. It's called EPaD Inc., which is empowering people against diabetes, where I do consulting, I do presentations such as today, and just working with people in order to help them better manage their diabetes.
Wow, you said you teach at the university here. Can you tell the viewers exactly where you're located so they know?
Yes, I am located in Austin, Texas, and I am at the university. Yes, well, you said that earlier. Yeah. And I have been here, I've been here in Texas now for the last, I guess about 25 years now. So really enjoy being here.
Wow, I had no idea that we were in the same. I'm so used to doing these segments. Everybody's all over the U.S. How ironic that you're located here in Austin, Texas with me. This is great. So we definitely have to get together for coffee or something one day. So
absolutely.
Tell me about the biggest challenges you see or you've experienced in working with people of color and helping them manage their diabetes.
I think probably the biggest challenge that I've seen would be their knowledge base when it comes to managing diabetes. For the most part, a lot of people think, okay, I take this medicine and my diabetes is good. And that's about all they can tell me. And they really don't understand the intricacies when it comes to their eating, how the medicine happens to work in their body. So there's a lot of educational pieces that are missing. And so that's what I've seen over my years with working with different people, especially people of color. That's what's missing.
Wow. So speaking about education, what do you see are the biggest gaps in diabetes education today?
There's a lack thereof, especially among people of color. I'm not really sure. I still, even to this day, it's hard for me to understand why I see the people of color not getting the education, because I've done studies with people and they have often told me they've never even been given the option to do diabetes education. So I was like, okay, so I see where my niche needs to be. But that's really has been the situation, is that there either is not offered. If it is offered, it's probably so overwhelming to them. They don't know how to apply it to their lives. It's like, yeah, I went to a class, but I can't tell you how I'm supposed to use the information that I received. And so one of my goals was to make sure when I'm educating people that it is on their level so that they can apply it. Is very practical. So that's one of my, the key aspects of me doing the education in the company, was to make sure it's applicable. And a lot of people enjoy that piece.
Wow, you brought up a really good point talking about the access. I know personally, I've interviewed physicians about the barriers to referring patients and clients to receive diabetes self-management education and support. And I've heard physicians say, well, Mrs. Jones or Mr. So-and-so, they're not going to go anyway, so I really don't even bring it up to them. And that's so unfortunate that you won't you know, that you won't give someone the opportunity to participate in something because you think, oh, you know, there's too many barriers, or they're not interested, or they don't want to make a change. I agree with you. There is not necessarily a lack of diabetes education available.
Right.
So, you know, it's not on everybody's corner, but there's certainly enough educators out there and enough programs out there that are available for people to join one, especially now that everything is virtual. It's even,
Right.
even easier to access. So
Yeah.
do you provide any of your services virtually now?
Now that we've had the pandemic, yes, yes, which has been, it was challenging at first because I like to be with people face to face, but we're making that transition for people very smooth. So it's been great.
That's the reception I've been getting from patients as well, is that they actually like it better this way, and they hope that even when the world opens back up, we will continue to still do things the way that we do them now. And I think that we will. So you're going to show or present to us some information today. Tell the viewers a little bit about what you're going to be sharing with us in your presentation.
Okay, sure. So I am going to present on diabetes management technology in you. And so I'm going to take a look at how the technology with diabetes management has progressed over the years. Over the last 50 years, we've seen so many different changes. And then I'm going to look at what the benefits are to using technology in order to manage your diabetes.
Oh, I'm excited for you to share this, because there are a lot of people that are managing their diabetes, and to this day, they have no idea what a CGM is. They know what an insulin pump is maybe, but they don't necessarily know how it works, and they don't even know if it's something that will benefit them. You know, sometimes I ask clients, well, do you know if your insurance covers it? And they've never even thought to ask. Their doctors never thought to, you know, mention it to them. And most insurances these days do cover those devices.
Right.
So I'm excited that you're sharing this information. We'll go ahead and let you get into the presentation. So without further ado, Dr. Sumlin, I'll let you take it from here.
All right, thank you. Hello, hello. I am so excited about presenting today on diabetes management technology and you. So we're going to go ahead and get started. I'm going to share my screen so you can see my slides. Okay. So first of all, these are my objectives. What I like to accomplish during this presentation is to talk about the progression of diabetes management using technology, and then kind of look at some challenges, but a lot of benefits when it comes to using technology for managing diabetes. And I have no financial interest or relationship to disclose at this time. So technology, first of all, let's think about that definition. It's a practical application of knowledge, especially in a particular area. It is a manner of accomplishing a task, especially using technical processes, methods, or knowledge. And so when we are thinking about technology, a lot of us think, oh, okay, you're talking about a smartphone, or you're talking about a smart TV. And so we got to remember technology can be moving from one phase of doing a certain thing, and we add new knowledge to it in order to do it in a better way. So let's kind of think of technology as an improvement. But the one thing we do have to remember is that when we think of technology and we think about how it's moving forward, it requires change. And change can be kind of challenging for some people. I remember when I first moved to Austin, Texas, about 25 years ago, and I had this electric typewriter, and I was really, I carried this typewriter everywhere because it was nice, it was thin, and I thought it was just state of the art. And I could do everything on a typewriter, and I was fast at it too. That's one of the reasons why I have my girls learning to type this day, to better use their computers. But, I brought my typewriter down here, and my husband was like, well, what are you doing with that? And I was like, well, this is how I communicate with people. And he was like, no, you're going to have to get rid of that. I need you to take some computer classes. And I was like, what? I couldn't stand taking computer classes in college. It was like, oh, you had to do all of this coding and programming. I did not like it. And I was like, oh gosh. So, eventually I kind of warmed up to the idea. I took some classes, and now, of course, I can't live without my computer. So what we have to think about when we're thinking about technology and diabetes management and the change that's required is the consumer has to change their mindset. You got to look at it as, okay, how is this going to make my life better? Okay, so that's what we're going to look at. How has technology progressed throughout the last about 50 years or so? Okay, so when diabetes was first diagnosed, it was in the 1600s. And the way that they noticed that people may have diabetes was they were going to the bathroom to urinate a lot. About a century or two later, they started having urine tasters. And so people would actually taste the urine to see if it's sweet. And that's the way that they started diagnosing diabetes. Fast forward to 1922. That is when we first saw insulin, where people can get insulin injections in order to manage their diabetes. So you can imagine what it was like before insulin was discovered in order to manage diabetes. So the people had to just basically look at their diet, their exercising, and then eating a really low carb diet. So we had insulin come on board, and the big thing about the insulin injections then is if you take a look at my screen, you see this very, very long needle, okay? But it was effective in managing diabetes. So this was the next great thing for diabetes management. Then as we come forward, we see our testing kit. So if you look at this testing kit, it looks awfully big. And the other thing is that we were still testing urine. And this was back in about 1960s, early 1960s. And so you put your urine in there and it's tested that way. And that's how you found out what the blood sugars were like. And then fast forward another couple of years, around 1970s, this is when we see Dr. Kadeshi develops the first insulin pump. And this insulin pump was like pretty much as big as a backpack, and it was worn on the back, but it was a way in order to help people manage their diabetes and get that constant infusion of insulin. So this is where we were about 1970s. And so we're looking at now coming from 1970s forward. So we're looking at about a span of about 50 years. So let's kind of first look at monitoring, okay? So with monitoring, within the last 50 years, we've grown by leaps and bounds, right? Okay, so first we had monitors that were fairly large and required quite a bit of blood in order to test that blood sugar. And as the years went on, our meters became smaller and smaller to a point where you only needed a very, very tiny speck of blood in order to get a blood glucose value. And then even moving it forward over the last few years, you can actually have a meter that's hooked to your smartphone. In your smartphone, you can have all of the blood sugar values stored there. You can put other things in there, like this is displaying carbs that you've eaten or even insulin that you've taken. You can record all there on your smartphone. And then this is another example here in the corner where it's connected to the Dario program. And that particular program, you check your blood sugar right here with this little device that's connected to the smartphone. And again, it stores the blood sugar values. But with this particular program, it actually connects to a healthcare provider who can help monitoring, check in on you if you're, having some issues. So, we've really grown a lot, we've come a long ways from urine tasting to checking blood sugars in today's society. So moving forward, this is not the only way we can get blood sugar values. Another way that we can get blood sugar values is through continuous glucose monitoring. And with this particular system, it's three different parts. So you have a sensor that goes underneath the skin with a transmitter, and it transmits to a receiver. Now, this receiver could be, a pump, it could be a smartphone, a smartwatch. So we have different receivers that it can connect to. With CGM, the great thing about this is that it will record a blood sugar value every 1 to 5, about 1 to 5 times, 1 to 5 times within a minute. So it just depends on what device that you have. But the great thing about it is it actually shows you a graph of what the blood sugars look like. And by looking at this graph, you're able to see trends. So you could set it up to where you have parameters, a high and a low, where you want to stay within for your blood sugar values. And so it will give you an alarm when you're going too high or an alarm when you're going too low. So, and then you can go ahead and be active and treat blood sugars that is going high or low more quickly and effectively with a CGM. And so this is one of the great pieces of technology that we have out today. And a lot of people love it, especially if you're one of those people who tend to go low. This helps to prevent that. There are a lot of options as well for CGMs. We have those who have type 1, so you'll see a lot of their CGMs connected to their pump. You have some pumps that have the CGM right there in it. Some are separate. It just depends on which device you end up with. We also have them for people with type 2s as well. So you can get like this, for example, what I have it showing here is the Freestyle Libre. So you put a little patch on the back of the arm and it will keep track of those blood sugars. It will give you that same type of graph. You can set parameters and it lets you know how you're trending throughout the day, which is, again, this is an awesome feature, especially for those people who have a hard time with pricking their fingers. Now, it doesn't completely eliminate you checking because you do have to calibrate the monitors, but you do want to make sure also if you're having a low to go ahead and check your blood sugar to make sure you're indeed going low and treat accordingly. But it does decrease the amount that you're checking. So let's say you're a person who checks anywhere from 4 to 7 times a day. Wearing a continuous glucose monitoring cut that down tremendously. So this is always a great option. And again, we're looking at the benefits to technology, and this is a great benefit for folks. So looking at with the CGMs, what do you get? You're getting being able to know when you're going low or hypoglycemic events. And this is especially useful for those people who have become unaware of hypoglycemia, so they don't know when they're going low. And so the CGM helps with that. It also provides how fast you may be going high or low. So that's always a great indicator so that you can treat accordingly. It also, again, it improves glycemic control because you can give it a target range that or parameters that you want to stay within so that your blood sugars are better controlled. And then, of course, like I said, it reduces the number of finger sticks you have to do. So CGM, this technology is great, and you're also looking at, for a lot of people, it's just a better way of living because you don't have to stick your finger so much or so often. All right, so next, let's look at insulin delivery because we have, again, grown by leaps and bounds when it comes to delivering insulin. So we still have our traditional vial and syringe. However, the big difference is the needles are not nearly as big as they used to be. So I happen to have a little needle here. Let's see, I'm trying to see if I can see it. There it is. Okay, so now if you can see, your needle is much smaller, much thinner in order to give those injections. So still a great option. This is for type 1 or type 2. And so that's where we kind of started out, made that a little bit better, but we have so many more options now. So next we have our insulin pens, okay? So where you have a pen instead of a vial and syringe. With this, people could be much more discreet when it comes to giving injections, because, you know, that was one of the drawbacks with the vial and syringe, is that people would actually skip giving their insulin during lunchtime, let's say, because they were at work and they didn't want anyone to know. So coming up with the insulin pens was great. And so then people were much more willing to comply with or get better glucose control because they were able to do that lunchtime injection. As time rolled on over the last couple of years, we have Vigo. Now Vigo, this is a little patch. This is we would say an insulin patch. And what it does, and if you see it with the woman here in the picture, you can actually fill this cartridge, and it's good for 24 hours. You put it against the skin and inject it. It's a little catheter underneath so that it stays underneath the skin to infuse insulin. And you can have both a basal rate that goes throughout the day. So that's going to be the amount of insulin that kind of flows, just like your pancreas would do throughout the day. And you have approximately, for your basal, about 30 units. And then you can also give bolus doses with your meals. And so it's simple as you just click, and every time you push down your little button, you're giving 2 units of insulin. So a person can actually release the button and give how much they need for their bolus. And so this is a great option for people with type 2 diabetes to use the Vigo and not have to do multiple injections. Okay, so that's the benefit there. You just have that one time a day injection to get this started, and then you have your insulin for the day. You don't have to carry around any not testing supplies, but you don't have to carry around a pen. You don't have to carry around pen needles and all of those things, alcohol swabs. So, you know, there's a lot in your little testing kit and your insulin delivery kit, but this kind of decreases all of those supplies that you would require. So the other neat way of delivering insulin is a freezer. So a freezer is actually inhaled insulin. And so you would not have to do an injection with this one. This is for your bolus doses with your meals. Now you would have to do a long-acting injection dependent on you and your healthcare provider, however your regimen will be developed. But you have, you can do inhaled insulin. Now this is for people who do not have any lung issue or diseases. So if you have any type of problems with your lungs, then this is probably not a safe option for you. But for those who are fine and willing, you can inhale your insulin instead of doing your injections with your meals. So that's another option. But again, we're looking at technology and benefits. All right. So that is some of the ways that we can deliver insulin and how we've progressed over the years. So we still have a couple other options. So there's also the insulin pump. Now, I have a lot of my type 1s that are on insulin pumps. However, I do have a few type 2s as well. So it really depends. You just need to talk to your healthcare provider to see what works best for you. So you have insulin pumps. Now, the thing about insulin pumps, again, we cut down on injections because you change these out every 3 days. And you do have a tubing that's connected to the various pumps, but there is one insulin pump that does not require tubing. And it comes with a pod instead. So it goes on just like the Vigo in the last slide. And this you can wear anywhere you do your insulin injections, behind the arm. You can also do on the stomach. So you will fill your pod with insulin, and then it's controlled by a little meter off to the side in order to give your boluses with your meals, and you set it up to calculate your basal rate throughout the day. And so you're able to do everything you can with the other pumps, except it's a pod instead. Now you are connected to the pod 24/7, as well as with the other pumps is a 24/7 connection. And some people, well, I would have to say the majority of my patients love the insulin pump because they get a tighter control when it comes to diabetes management. And a lot of people think, kind of have in their minds, well, I'm attached to something 24 hours a day, 7 days a week. But after trying it out, they get used to it. You know, it's like, well, how do I sleep? You just throw it in a bed with you and it's fine. The other option that we have with insulin delivery is our EPaD. So again, EPaD is going to be for our type 1, people with type 1 diabetes. And the neat thing about EPaD is that you don't have to be connected to something 24 hours a day, 7 days a week. And it also works very similar to an insulin pump, meaning that you can put in your parameters for your target range for your blood sugars. You can put in your basal rate in there. You can put in your boluses. You're calculating your insulin carb ratio. So all of those things can be calculated in on the app that's right on your smartphone. The two talk to each other. And so you kind of get the same results you get from the pump, except you're not connected to anything. So the one drawback with this particular device is that it is just the fast-acting insulin, not the long-acting insulin. So you still would need to do a long-acting insulin injection. However, a lot of people still love it because you have all of the features of a pump on a device and you're not connected to anything. So that is the smart insulin delivery system called the EPaD. And again, this is for the people with type 1 diabetes. So we've kind of looked at the different ways on how technology has progressed over the last 50 years or so and continues to progress. And so let's look at one other area, which is apps. Okay. Oh my gosh, there are so many apps available for smartphones when it comes to diabetes management. You have apps where you can test your blood sugar and keep that in there. What you're eating, you can carb count on there. You can put your weight in there. You can put your heart rate in there. Whatever you need, you can find an app that really fits your needs these days. And then I spoke briefly about the Dario system, where it's also an app that actually speaks to healthcare providers. And there's several apps like that are designed to speak to the healthcare provider so that you can get more immediate feedback when it comes to managing your diabetes. So we have to make sure we talk about apps because they are so relevant today, especially with smart devices. So now let's look at the benefits we've talked about. So with blood glucose monitoring, we've come a long way. And you know, one of the questions that I tend to get with blood glucose monitors is, you know, which one is the best one? It really depends on you. You know, you and your healthcare provider talk and see which one is the best one for you. But when you're talking about your everyday meters where you're checking multiple times a day, the meters, you know, they're on average, they're about the same. But the key when you're looking at meters is to make sure you stick with the same meter each time. So you don't want to say, okay, today I'm going to use my AccuCheck, or tomorrow, and then tomorrow I'm going to use my One Touch. You don't want to do that. You want to stick with one or the other and be consistent, because there are going to be differences in the values that you get from those meters. So you may check on your AccuCheck right now and it says, okay, I'm 125, but then check on the One Touch, it may say 145. So you don't want to use different meters. You just want to stick with the same meter. Now, when it comes to including the apps and things, those are great benefits, because You don't have to keep up with the little books. I don't know how many people remember the little books you would get that had all of the blood glucose reading in there. I can't tell you how many people, they would lose the little books. They would lose the piece of paper they were trying to keep track of their blood sugar values. So the great thing about the meters today is we have the apps that you can store those blood glucose values in there and take them to your healthcare provider, or even send them. You can email them now. So those are great benefits when it comes to blood glucose monitors. We talked about the CGM and the great benefits you have there. Again, it's going to be the big one for my patient is knowing when they're going low, those hypoglycemic events. If we can prevent those, people, they have such peace of mind with that. So, and then ultimately with the CGM, you do get improved glucose control because you have that constant feedback or those constant readings to know how your blood sugars are doing. Are you trending up? Are you trending down? So you have that right there in the palm of your hands. So that's awesome. Then we talked about the insulin patch, like the Vigo, for example, 1 injection a day. 1 injection a day, okay? How great is that, especially if you're doing multiple injections with a long-acting insulin. You're doing 1 injection in the morning or in the evening, or doing both, and then you have your injections with your meals. So you cut that down to just 1 injection a day. Then you have insulin pumps. So there's all types of pumps out there, and a lot of bells and whistles on them. But the great thing about the pumps is that you can give target ranges where you want to get alarms when, let's say, you're going high, or you want alarms when you're going low. Or it will even suspend insulin delivery if you're going low. So you can program that in the pumps. How great is that? So insulin pumps, that technology is there. It's useful and it has great benefits. Now, the one thing I didn't show a picture of is the artificial pancreas. I have some patients with type 1 diabetes who are going through trials with that right now, where the pump is a little bit more intuitive as to delivering insulin. So not just giving you that basal dose, but it also gives increments of boluses as well based on the blood sugar values that it's receiving from a CGM type device. So it's becoming more and more closed looped, where you can get that automatic insulin when you need it, just like a regular pancreas. And so that is on the pipelines. Like right now, that's what I'm seeing my people with type 1 diabetes. They are in those trials right now. And so that's going to be an awesome piece of technology that will really improve people's lives. So let's just briefly about some of the disadvantages. So first of all, you're talking about technology. It's a piece of equipment. And so of course things goes wrong. But you don't have that as frequently as long as you have backup plans in place, as well as you're very knowledgeable about the device. And so education is really key when it comes to using any type of technology so that you don't run into errors. Another big thing that I have on the screen, of course, is cost, okay? Anytime you have something new, it tends to be higher in price. Over time, the prices do decrease. And then you have where when you can kind of get Medicaid on board in order to cover some of these things, the other insurances tend to come along and try to help with coverage as well. So cost can be a disadvantage when it comes to new technology in managing diabetes. The other big thing about that could be a disadvantage is technology is always changing. It changes so fast. So today I went over some of the improvements we've had over the last 50 years or so, but it's always changing. So within the next 6 months, there'll be something new out, and it's kind of hard to keep up. So you wonder, okay, I have this type of meter today, but in 6 months, there may be this newfangled meter that does everything for you. Do you switch? Well, that's going to be a decision that's up to you. You know, the thing is, think of it as benefits. How does it benefit your life if you switch to a different technology? If you see that it's going to improve your life, improve your quality of life, I would say go ahead and try to make that change. So embrace change. I know sometimes change can be difficult. However, if we embrace the technology we have in order to manage diabetes, you get such an improvement because with that improvement, we have a better peace of mind. You know, there's nothing better than to know going to bed at night and always used to having that fear that you're going to go low. But now you have a piece of device or a piece of technology that will alarm you when your blood sugars goes low. That is peace of mind. That is a better quality of life. So we have to embrace technology. And it's constantly improving and it will continue to grow, but don't be afraid of change because those changes improves your life. Thank you.